Donation is being undertaken at the Kapkatet grounds in Kericho County, where the Universal Health Coverage Conference has been conducted all week.
So all the target was to have at least 1,500 units of blood donated by the end of this Mashujaa week. As it stands now, 1,300 units have already been collected so far. All this with the help of technology, as Sheila Chelangat reports from Kericho County.
According to the Kenya Blood Transfusion and Transplant Services, every 10 minutes, 10 Kenyans urgently require blood transfusion, this need triggering a widespread appeal for Kenyans to be their brother's keeper. Residents from Kericho County flocked this blood donation center, a patriotic and selfless display of the true Kenyan spirit.
It's my first time donating blood. I was a bit nervous, but actually when I donated it, after some minutes, I felt some dizziness, but after some time, I regained the consciousness and I was just okay.
Kuwa na motivation ya kutoa damu at least every year, because I've been seeing people need blood in terms of emergencies, and that's why every year at least I donate blood.
But at the heart of this exercise is a game-changing technology, the apheresis machine, only found in 11 facilities in the country.
What happens is this machine, we collect from the donor what we want. What we don't want, it goes back to the donor. So the donor benefits, the patient benefits, right? Unlike the other one, we talk everything. So in the event, we prepare component, the remnant, we throw it away, right? But this one, both the patient and the donor benefits.
With this machine, specific components of blood can be collected, thus addressing specific needs of a patient.
Those days, you get blood as a unit from the donor. And at that point, you take it back to the laboratories and prepare different components. But now, as a country, we've introduced technology to prepare or get or donors donate what we want, not the whole blood. So if we want platelets, we get platelets from our donor. If we want red blood cells or packed red blood cells, we get packed red blood cells from the donor.
In the run-up to the upcoming Mashujaa Day celebrations, the Blood Transfusion and Transplant Service had a hopeful target, at least 1,500 units by Friday.
This is really Mashujaa. These are the Mashujaa that we must celebrate. The donors are the real Mashujaa. You give your blood, you don't know even who benefits from this blood. I mean, without looking at who will benefit, these are the true Mashujas.
And the Kenya Blood Transfusion and Transplant Service is betting on this apheresis technology to enable Kenya reach its goal of having 520,000 units of blood in a year.
We have been on an upward trend. 2 years ago, the country only managed to collect 294 units of blood.
A significant increase in units collected has been witnessed, with over 400,000 units collected so far.
Blood is central in the health sector, and as Kenya strives to attain UHC, it requires at least 520,000 units of blood for its population annually, a figure that we are yet to attain. That's why you and I should at least make an effort of donating blood this year. Sheila Chelangat at the Kapkatet grounds in Kericho County for TV 47.
Thank you, Sheila, for that. And let's stick around in Kericho.